will be able to get a recording. All right, if you can please keep your, for bandwidth, it's best to have your camera off and keep yourselves muted. The bottom right-hand, well, the bottom sort of towards the right, reactions, if you click on that, that is where you can put your hand up. If I can ask you to allow me to get through the presentation and keep your questions for the end, I will make sure that we've got ample time for Q&A. All right, so I'm going to share my screen and I hope that you will see the presentation in presentation mode. Can I confirm that you can see that, please, Gabo?
Yeah, I see, Jackie. I think it's clear.
Fantastic. All right. So first thing I'd like to do is just to take you through some of the ICPA head offices processes that we've been doing on your behalf. It's quite a complex system to navigate to become a vaccination site. So the first thing we had to deal with was the master facility list, or what they call the MFL. And in the MFL, you register as a COVID-19 vaccination site and you apply for the COVID-19 Section 22A15 permit. So this was done for you by ICPA, all those pharmacies that indicated they wanted to be a vaccination site. We took you through the SAPC curation process. And once that was done and accepted, then SAPC issues a token which goes through to the RP via email. At this stage, the RP needs to click on that token and complete the compliance questions. That then goes back to council. Council then recommends to the NDOH for approval, and once approved, you receive your electronic permit. Okay, so then you are ready to rock and roll. And now what I can tell you is that at the moment, Pharmacy Council has approved 1,191 pharmacy permits, and out of that, only 2 were declined. So that's really good news. So theoretically, we've got nearly 1,200 pharmacies ready to vaccinate. The next system we have to navigate is the electronic vaccine data system. You would have all heard about this, the EVDS. It's where people that want to be vaccinated register, and where we will register 2 different systems. So there is the EVDS scheduling administrator. This is on a mezzanine platform, and this person books and monitors appointments. And I will take you through this in a bit more detail later. The second part of the EVDS is where we register vaccinators and admin. So these are the admin staff that support the vaccinators. Once again, there is a spreadsheet which you need to complete with all your vaccinators and admin staff. And ICPA has got creator and approver with super user capabilities. We are able to create and approve all of these accounts for you. As we do that, an email is sent to the vaccinator or the admin staff, which must be activated within 36 hours, otherwise you become inactive. Also, if you forget your password or your account becomes inactive, you just phone the office or email the office and we are able to reissue you with your passwords. So this is quite nice. It's been decentralized and you don't have to deal with the Department of Health. The last system, and all 3 of these systems talk to each other, the last system is the stock visibility system, or the SVS. Again, there's a spreadsheet that you need to fill in and send to us a person that is going to register as the SVS admin person. We've recommended the desktop app. So basically you send the info to us, we refer it to the SVS team. They then send us your enrollment code. These enrollment codes are sent to each of the pharmacies that are about to become vaccination sites. You click on them, it downloads the app onto your computer, and you are then able to log in with a login username and password, which is emailed to you via the SVS platform. This is the system that you will use to receive your stock and report daily back to the NDOH. And this is critical because if the reporting is not done on the SVS, they will not send future orders. And then the last step is to actually place your order. And again, we have a template. You fill in your template with whichever vaccine you decide on. You send that order through to us. And we have 2 times that we put orders in. It's before noon on a Tuesday, and that is for receipt the following week, Wednesday, Thursday, or before noon on Thursday, which means you'll get your stock the following Monday. I'm going to take you through quickly the distribution process. So you can see over, let me just get my cursor. Distribution comes from the central warehouse. So that's from the Department of Health, and it comes either via BioVac or DSV. The reason they ask you to open accounts with both distributors is because you're not sure which distributor you're going to get stock from. It depends who's got stock. So these vaccines are then distributed to the primary distribution site. You as pharmacies are a primary site. And here the RP takes receipt. And then we move on to the next one, which is where the stock arrives. You receive the stock. The stock comes with the, what are they called? NAT joints, which apparently they come with automatic machine guns, a lot of security, because apparently these vaccines are very valuable and they are worried that they'll get hit on the road. So don't be alarmed when NAT joints, which is the South African FBI, arrive with the distributor to drop off your stock. You sign the POD. The responsible pharmacist then records the stock and reports it on SVS. You do need to, before signing the POD, confirm that the temperature has not been compromised. Now, this is important. The Pfizer vaccine arrives at -70 degrees, and the Johnson & Johnson vaccine arrives at -20. So please check that the temperature has not been compromised. If it has, you need to let us know immediately, or possibly don't even sign for the stock. If everything is all right, your stock is then moved into your storage. So you need to have some form of protection, some sort of gloves or something to handle these vaccines, because they are coming at ultra cold temperatures, but they will go into your fridge at this stage and they will thaw to between 2 and 8 degrees. And then your stock is ready to be used. Next system, we all know the EVDS. So you know that people have been self-registering. At the moment, only people that are over 60 can register on the EVDS. They receive an SMS, which is a notification to confirm registration, vaccination site, and their vaccination code. They will then go on vaccination day. They present with their vaccination code to the site. They'll have the details in an SMS. You confirm eligibility. The vaccinator then completes consent and questionnaire on the system, and the vaccinator can administer the vaccine. This process down here, if there is no electricity or connectivity, there are manual forms, and we will make sure that you have manual forms. First prize is to do everything in real time. You don't want to be back capturing, but it is possible to do this. And in fact, our very first 2 sites that came on, for the first few days, they were completely manual because the EVDS was not ready to receive them. I wanted to show you here the immunization process flow, and this is for a vaccinee. So this is a person who arrives at your pharmacy. So the first thing, they come in, you do a symptom check, eligibility, they go to the waiting area, registration and ID check, medical screening, and informed consent. This, we reckon, takes about 10 minutes. They then spend about 5 minutes with the vaccinator, and then they go into the post-vaccination waiting area for observation time, and this is 15 minutes. So each patient will take about 30 minutes to go through the whole process, not including if they have to queue before they get in. That's not to say that it's 30 minutes with the vaccinator. I'm going to take you through the screening now. So the vaccinee will arrive at your pharmacy. and go to the screening station. So this may be at the front door, or it may be, I'm not sure how you're running it, but a lot of people have their security taking temperature and asking a few questions at the front door. If it's not at the front door and somebody's coming for a vaccination, then your security or your staff at the door need to direct the people where to go. You don't want to let somebody with a fever or any of the signs or symptoms of COVID into the pharmacy. So the vaccinee is screened for COVID-19, and then you need to make a decision. If they have any symptoms, they fail, and you do not vaccinate. You send them to home to quarantine, or if they have any serious symptoms, to a GP or a health facility. If they pass, you then proceed to administration. So in the administration side, your marshal is going to direct them to the administration desk. So this is somebody, and it could be your vaccinator if you're a small site. I would recommend, if you have the staff, that you have a separate admin staff, and then your vaccinators can really just get on with the job of vaccinating. Because the vaccinator needs to confirm proof of registration. They need to verify the ID document and the voucher, or they're now calling it a vaccination code. And the vaccinee is confirmed on the beneficiary list. They can then proceed to vaccination, and that's where they go to the actual vaccinator. If they do not pass this, then they need to go to somebody that, for instance, they don't have a vaccination code, they are a walk-in, then they would need to go and be registered on the EVDS. And it could be your admin person doing this, or maybe somebody else will help them register on the EVDS if they are over 60. So the vaccination process, the person, once they've had their ID verified, everything done, they will then go to the vaccinator. Again, the vaccinator will log in, confirm proof of registration and ID and the vaccination code. The vaccinator will complete the consent and the questionnaire with the vaccinee. The vaccinee does not provide consent, obviously that's the end of it and they leave. If you get consent, you move on. And the vaccinator will prep the injection, administer the vaccination, capture the vaccine batch details on the EVDS, obviously dispose of the syringe and needle, mark the vaccination as complete. At this stage, the recipient will receive a confirmatory, sorry, somebody's making a noise. Please, can you mute? I'm trying to see who is unmuted. I can't see who is unmuted, unfortunately. Oh, it's Coffee. I'm going to mute you, Coffee. Coffee, if I could ask you to mute yourself, please. There we go. All right. The recipient will receive a confirmatory SMS to say that they have been vaccinated. At this stage, you will need to complete the vaccination card. And this card you need to actually print yourselves. We will supply you with a template. Then the recipient goes to the observation area where they are observed for 15 minutes. This area can actually be outside the pharmacy. If you've got a covered area, you just need to pop some chairs down somewhere. And this does not need to be a medical person observing them. Anybody can be just monitoring the observation area. If there are no adverse events, the vaccinee leaves. If there is an adverse event, and I can tell you there has not been one death from anaphylactic shock to date, and there have been millions of vaccinations. So it's highly unlikely. In fact, the only case I've had reported to me from one of our pharmacies was somebody fainted before they got the vaccination. So we haven't had any adverse events following vaccination. But if there is an adverse event, it could be a vasovagal reaction or maybe some itching, then the medical staff would respond and treat. You would capture this on the record and then the vaccinee would leave. Guys, I will take you through which forms you do need for that. And even though there is a very slim chance of any anaphylactic reactions, you do need to have a full emergency tray. It's one of the requirements. I'll just show you a schematic of a very simple vaccination site. This would be in a small pharmacy. You can see, very small pharmacy. Basically, people would come in, go, there'd be a little waiting area, there'd be a registration area. From there, they could go into the clinic, see the nurse. From the nurse, they would go to the observation area, be observed for 15 minutes, and then they would leave. So this is a very simple site. Obviously, as you have more vaccinators, it would change. What some of our pharmacies have done, this observation is actually outside. They've got permission from the mall to put chairs outside, and the people actually sit with social distancing outside the shop just for the 15 minutes. The nurse will say, right, you've had your vaccination at 19:30. If you could just stay nearby until 19:45. And then the vaccinee knows when they can leave. The next thing I'd like to take you through are just the daily procedures. So every morning, best thing to do is, well, firstly, make sure your hours of vaccination are up so that people know. We all know that staff must wear name tags. That's a council requirement, that the site is clean and the surfaces are disinfectant, that hand sanitizers available at each station, that there's an appointment register if you are doing walk-in bookings or telephoned bookings as well. Remember, you will have a scheduling register, which is on the EVDS. You are able to print that out if you wish to. Otherwise, the vaccinators and the admin staff can actually see it in real time. If you've got a number of vaccination stations, have them numbered so that you can direct people there. You need to have some sort of bin or something in each vaccination site, plus a sharps bin, a thermometer available for screening. That should be in the front of the pharmacy somewhere so that you screen people before they even come in. A COVID-19 screening register. So those are just the questions that you would ask: fever, sore throat, cough. We all know the questions that need to be asked. Some PPE for the vaccinator. Please note at this stage that it is not a requirement to have gloves on for every vaccination. The gloves are to protect the vaccinator. So obviously, if a patient is HIV positive or has some sort of infectious disease, then you would need to have gloves on, but otherwise you do not require gloves. You do need to have a mask, a surgical mask. It does not have to be an N95. You're not doing any procedures that can cause aspiration of these viral particles. The vaccinee will be wearing a mask, but you do need to have an apron on and to be sanitizing between every patient. You will require a device to record stock for the SVS, a computer or a tablet at each vaccinator. The same for admin. You will need to have tables and chairs, social distance applicable. And at the beginning of the day, the vaccinator will need to log on to their EVDS account, and the same if you have admin staff. You need to check that the fridge is fine and that the temperature was maintained overnight. We know that the temperature's got to be recorded twice daily, and if there are any fluctuations, you need to let the RP know. In the things that you will require, you will need a hard copy of the EVDS form just in case the EVDS goes offline. This includes the consent form, vaccination form, and vaccination cards. That will all be given to you in a pack. Adverse event reporting is also important. You need to have all of those forms. There are 3 different ones. And then your ancillaries. Please make sure that if you're getting 50 vaccinees in that day, that you have sufficient needles, syringes, cotton wool balls. They do say here that you need to have a saline mini bag. I'm not too sure why they've put that there, because in fact the diluent, if it's with the Pfizer vaccine, the diluent is a 2 ml diluent. These procedures are from the Department of Health. You need to make sure that your emergency tray is adequately stocked. And yeah, obviously, if the temperature in the fridge is below 2 or above 8, you need to let the RP know. At the end of the day, again, there would be cleaning, and you'd need to have some sort of infection prevention control policy. If you are storing vaccines in your freezer, some pharmacies have got -20-degree freezers. You would need to thaw the vaccines that you require the next day. So take them out of the freezer and pop them into the fridge. You would need to lay out your consumables and PPE for the next day, and make sure that your sharps bins are not too full and that you have got new ones for the next day if that is necessary. On the system side, it is at the end of the day that you have to update your SVS. The Department of Health requires SVS reporting on your stock holding at the end of every day. And then the last thing, obviously, is to plan for the next day, make sure that everything is laid out ready for the vaccinees the next day. On the reporting supplies, so these are the 3 forms you'll require for adverse events. So case reporting forms for adverse events following immunization, case investigation form for serious adverse events following investigation, and adverse events of special interest. And the difference between the forms is explained in the training, but I can always update you on that. Vaccination cards, as I say, we are given a template by the National Department of Health, and we need to print these vaccination cards ourselves. The cost of the card is included in the administration fee. And then the last thing is the paper-based recording tool, just in case the EVDS goes offline. I'll quickly take you through the 2 vaccines that are available at the moment. So the 104 pharmacies that are coming online in the next week or 2, or when the Johnson & Johnson vaccine is released, are down to receive the Johnson & Johnson vaccine. So this vaccine is available for people over 18. The dose is 0.5 mils, and it comes in a 2.5 mil containing 5 doses. It was a liquid suspension for injection, and it is administered with either a 1 or a 2 mil syringe with 0.1 mil graduation and a 22 gauge or 23 gauge needle, and the sizes are there. So those are the ancillaries you require. At the moment, the only wholesaler that has got stock is Transpharm. But if you are struggling with syringes and needles, just let the office know and we can try and source for you. For those interested in the Pfizer vaccine, this is for individuals over 16, but you'll know we're only going to be vaccinating people over 18 at the moment. The dose is 0.3 mils. It comes in a 3 mil vial containing 6 doses. It is a freeze-dried vaccine. The diluent does not come with the vaccine. When you place your order for Pfizer, you have to place a separate order for an equal quantity of the diluent from Adcock Critical Care. This diluent comes as 2 mils, and you need to draw up 1.8 mils of the sterile preservative-free sodium chloride and very slowly inject it into the Pfizer vial. The Pfizer vaccine is very friable, so you mustn't squirt anything in or shake it up. There is special training for the Pfizer vaccine reconstitution. The diluent is stored in the fridge, so it's at the same temperature as the vaccine. It should never be frozen. And here you're going to require a 0.3 mil, 0.5 or 1 mil syringe. The syringes we recommend are with minimum dead space. So we have found from one of our vaccination sites that you can actually get 7 doses out. And this makes a big difference. It gives you a bit of margin if you're able to get 7 doses out of the Pfizer vaccine. And again, it's the 22 or 23 gauge needle, 28 millimeter, and the longer ones, the 38 millimeter, if you have an obese patient. I'm not going to go through all the ancillary items. This presentation is going to be provided to all of you. I have gone through a lot of it with you already. Vaccine orders. We've had a lot of questions around the vaccine orders. So the Pfizer vaccine will arrive at your pharmacy at -70 degrees. Pfizer stored at -70 will last until its expiry date. When you receive it at the pharmacy, those with freezers can pop it into their freezer at -20, and it will last a further 14 days at -20. Most of us will receive it into our fridges between 2 and 8 degrees, and it will last 31 days. So most pharmacies, you must use that vaccine up in 31 days. Those with a freezer have an extra 14 days on top of that. The minimum order pack size for Pfizer is 195 vials, which is 1,170 doses. So to get through those doses in 31 days, you need to be able to give 51 vaccinations every day, 5 days a week. That's important. Before you order it, you do not want to waste any of these vaccines. Wasted vaccines that are not used are for our own expense. The cost of a Pfizer vaccine, the minimum order is 360,921 Rand. Moving on to the Johnson & Johnson. This vaccine arrives at -20. If you have a -20 freezer, you can keep those vaccines until their expiry date. If it goes into the fridge, it will last 90 days. The minimum order is 480 vials. You cannot order less than 480 vials at this stage. That means your order is 2,400 doses that must be used in 90 days. This means if you are vaccinating 5 days a week, you need to do a minimum of 38 vaccinations per day in order to get through them before they expire on you. The minimum order for Johnson & Johnson is the huge amount of 688,704 Rand. So these are big numbers for us in community pharmacy. But what I can tell you is at the moment, the demand is far exceeding any vaccines out there. So I wouldn't worry that you're not going to get through them as long as you can do those minimum vaccinations per day. The EVDS scheduler can schedule those to you. I'm going to take you through the latest we've had. This is from the DG of insureds, in other words, people on a medical scheme versus uninsured or state patients. So I'm going to read this to you. The National Department of Health will not pay for uninsured walk-ins to private sites. These individuals are to be referred to public sites. And that's what Gabo and I were talking on the radio about. We are strongly advising the Department of Health to revise this, because this really is discriminatory when you've got an elderly, uninsured person and you have to turn them away. But anyway, at the moment, this is what stands. There is an exception. The exception is that private sector sites are authorized to vaccinate uninsured walk-ins aged over 80 years and reclaim the cost from the state. This cohort is not expected to exceed 5% of the private site's vaccine allocation. So just make sure that if you are vaccinating eligible uninsured people, that it does not exceed 5% of the vaccines that you have, or you could run into difficulties and the Department of Health may not reimburse you. When you do over 80s, obviously you would need proof of age, which includes ID, a passport or driver's license. Walk-ins are not guaranteed to receive a vaccine on the day of registration or at all, and may be required to return on another day depending on site capacity. And those are not my words, that's taken directly out of the DG's letter. I'll take you quickly through claiming and payment. So insured vaccinees, people on a medical scheme. This is a PMB condition, So if they are a hospital plan, it does not matter. They will be covered. You are guaranteed payment. You will claim for the vaccine at cost price. There is no markup on the vaccine. And you would claim for the administration fee. There is a NAPI code, and it is 80 Rand and 50 cents, including VAT. Uninsured vaccinees, and we've already spoken about the conditions around these. You can claim for those that are over 80 or those that have been sent to you via the EVDS. So this is the one other exception. If an uninsured person arrives at your pharmacy and they have an SMS that says you must go to this pharmacy on this date and this is their vaccination code, then you are guaranteed payment. You would then use the MediCredit code, DOHUP, and you would claim in the same way that we claim any medical scheme. So this is almost like the Department of Health medical scheme. Payment for uninsured, though, is slightly different. It is on a credit note system. ICPA is in the throes of signing an agreement at the moment. We will be signing on your behalf, and we will then require a mandate from you to basically subcontract to you. This credit note will be passed on the vaccine account. So if you have an account, if you've ordered through DSV or BioVac, you will have an account with the National Department of Health, and a credit note for that vaccine will be passed. So in other words, the vaccine costs you nothing, and a credit note would be passed for the administration fee. So 80 Rand and 50 cents will be credited to your account and offset against your other purchases. So that's the only important difference between uninsured and insured. What I'd like us to discuss going forward, this is my last slide, which I'm glad we've got half an hour for questions, is the sharing of vaccines between pharmacies. I've had lots of questions from vaccination sites saying 688,000 Rand is just too much for me to take on. Can we share vaccines? I'm also going to talk a bit about scheduling versus walk-ins and getting that balance right. So there is training on the scheduling for the scheduling administrator. Right at the beginning, you set up a template which governs how many people you can vaccinate in a day. And then say it's 100 people, and you decide that you want the scheduler to schedule 80% of all of your vaccinations for the day. That means the EVDS will schedule 80 people to your pharmacy, and you can then allow for 20 people to walk in. So possibly here you could phone your regular customers that are over 60 and do them on your own appointments. We've got a lot of variation here. Some of our pharmacies have gone for 80%, some of our pharmacies 50%, and some of our pharmacies have opted not to have scheduled appointments and have rather gone for full bookings over the phone. This is entirely up to you. The Department of Health would prefer you to use the scheduling system, because that way they know ahead of time how many vaccines you need. So, but you are able to govern that yourself. If, for instance, one of your vaccinators needs to be off next week, you could actually book out that day next week with no slots. So it's a very nice system. You're also able to send SMSs via this system to people that are coming, reminders or something like that. I also want to talk a bit about mobile services, temporary outreach vaccination sites. And these temporary outreach or mobile services could be to old age homes in your area. Employer groups might approach you and say, please come and vaccinate all of our staff. And it could also be medical scheme members. So I know that some of the medical schemes have approached a number of our pharmacy groups and said, please, can you be a vaccination site for our members? I also would like to talk a bit around working with GPs in your areas. It'd be a good idea to bring the GPs on. A lot of the GPs cannot vaccinate 50 people in a day because they still need to see their normal load, but they may want to do 5 or 10, and possibly you could partner up with them and they could come and fetch 1 vial from you or something like that. Then lastly, also want to touch on expanding your vaccination services. So a number of our pharmacies have said there's an empty shop above us or next to us, and we'd actually like to move this whole vaccination service outside of the pharmacy. And this you can do. There's no problem there. Council has no problem as long as the vaccines are stored at the pharmacy. And then you would put them in cooler boxes and take them into the empty shop and vaccinate from the shop. Just have some signage because people are going to pitch up at the pharmacy and they would need to know where to go. Okay, so on the sharing vaccines, at this stage, pharmacy groups are sharing. So we have some pharmacy groups who have their own wholesaler. They are ordering the stock into their wholesaler, who then breaks the pack down and distributes to their members. This is already happening in a couple of our groups, Sparkport, Van Heerden. What we are trying to find out is, could pharmacies that are not related or not part of a group also share vaccinations? We have asked this question. We have not got approval as yet from the National Department of Health, but I have asked Pharmacy Council. Council has no issue with it. They cannot see any regulatory reasons why we could not do this. And I know that Ahmed and Mibub Kasim have been looking at different ways we could do this. We could have one pharmacy ordering in the vaccines and then linking other pharmacies to them as temporary outreach vaccination sites so that they can distribute the vaccines there. We just need to operationalize this in that, how do we work out the credit note system? How do we look at the payments? Because obviously there's one pharmacy taking on the risk. So that is a work in progress. Okay, guys, Gabo, at this stage, I am going to hand over to you and we can open up for questions.
Thank you very much, Jackie. I think the slides make it very clear what is possible and what is impossible. And I must mention that there's a lot of colleagues who have been closed out by the system because of the number of participants limited to 100. I'm seeing on the groups that there are people who are waiting to come in, and unfortunately they couldn't come in. But we will make this, because the recorded webinar will make it available to all groups, and we will take questions on the groups or through the office. I'm sure that will be able to alleviate the pressure of those that couldn't come through. So thank you, Jackie. We had a few questions that have come through the chat box. I'm just going to go through them one by one, and then we can see how we can best attend to that. Mr. Dyer is the one who has been dominating the chat box there today. He believes that we must convince the department to relook the issue of the walk-in policy. He believes that those that are qualified or eligible, even though they didn't make a booking, may be allowed perhaps to do the walk-in, even if they are below 80, as you have mentioned. Do you have a comment there, Jackie?
Absolutely, Gabo. And I actually said it on national TV today. For me, that is discriminatory. That medical scheme patients can go to a state facility or a private facility, but state patients have to go to a state facility. The whole idea around this vaccination rollout is equal access. And I actually called it discrimination. I'm probably going to be in trouble, but we are pushing very hard that this be opened up. If a person stands in a queue to the pharmacy, why should we have to turn them away? It just isn't right. And I know that the unions cannot be happy about this. I mean, a pharmacy effectively cannot vaccinate its own staff who are not on medical aid. It just isn't right. And we will do our best, Gabo, through you, through Mogologolo, through Sham, through all of the directors. We will be pushing as hard as we can to make this a very fair system, that anybody that walks in that is eligible in that particular phase can be vaccinated, whether they are insured or not.
Thank you, Jackie. The next comment again for Mr. Dyer It says on the EVDS registration, a lot of patients that are below 60 want to be vaccinated. Is there a way to have them registered even though they're below 60? And also it is coupled with the one of those that have comorbidities but are below 60. I believe those ones are still coming in the next phase. Jackie?
Yes, you're quite correct. So the Department of Health is very strict about this. If you try and vaccinate somebody who is under 60, the EVDS will not allow it. So you just cannot, even if they have comorbidities. This was a decision that was taken in that everybody over 60, probably we're going to catch a lot of the comorbidities in that age bracket. Also, they have shown that it's people with comorbidities that are in the older brackets that are at high risk. So at this stage, if they are under 60, we just cannot vaccinate them. Even I've had pharmacies phone me and say the doctor is motivated. It doesn't matter. We cannot vaccinate them. There was a question, Kabo, there was a question as well about healthcare workers. So healthcare workers are professional staff that did not manage to get vaccinated under Sisonke. We are busy with a project with vaccines for healthcare workers. So professional people, our assistants, our basics, our post-basics, and our pharmacists, our nurses, if they have not been vaccinated, can register on the V4HCW and get vaccinated. What I can tell you, between Khabo and Sham and myself, we are pushing for all our non-professional staff. And I think we have found a solution. We will be sending out the data that we will need, and we will be doing a bulk upload of these staff. So any of your staff who wish to be vaccinated, we think it'll be an ID number, and that's all we will require, but we will let you know. We will do a bulk upload, and then regardless of their age, if they're working in the pharmacy, security guard, driver, cleaner, it doesn't matter, we will get them vaccinated. So there should be an info flash going out in the next few days, Kabo, with confirmation of this, and then we will get all the healthcare workers, regardless of age, vaccinated.
Thank you, Jackie, for that. The last one from Mr. Dyer. If I already have a DSV account, do I need to apply for another one? And if I filled in the BioVac forms and I have them submitted to DSV, will the account be activated? Jackie?
Okay, so the DSV, if you've got an account, that's fine, just leave it at that. You do need to apply for a BioVac account. It won't be opened. Okay, it will not be opened until an account, until an order has been approved by the National Department of Health. So don't stress, just submit the form. And don't worry when it's not opened. It will be opened when your order is approved. Khabo, I can see a hand up.
Yes, I got the hand of Cheryl and Clive. I was thinking maybe I will note those hands, quickly finish the chat box, and then I can take the hands of Clive. Or I can go ahead, Clive, come through, or Cheryl.
Hi, thanks very much. With load shedding coming, I've got a comment and a couple of questions. I think for time I'll just give them all together. The first one is, if we're taking in this nearly R750,000 rands of the stock, I would suggest members check their insurance policies very carefully. We found some loopholes in our policy and we're having to have them amended. So it's quite a risk there. The second question I need to have answered is, what is the normal wastage that we could expect? At the local command meeting the other day, they indicated that hospitals were experiencing a 7% wastage, which they thought was pretty good, and I thought was pretty shocking. So that then, Jackie, you mentioned that the credit for that extra would be passed through for the uninsured ones would go through whichever the distributor was, and that'll be offset against stock. But what happens if you don't buy anything from BioVac? Then how would it work? For example, if that was the supplying company. And just on that instance, DSV had indicated to us that they were not activating anything until they had heard from the Department of Health. I did forward that letter through to the office. So perhaps we need to follow up with DSV what their story is. Thank you.
Thank you, Clive, for the good question and good advice. Indeed, that indemnity may need to be reviewed just to make sure that we are on par in terms of the new program of the vaccines. The indemnity policy indeed must be revisited. And then the normal wastage, Jackie, I'm sure you want to attend that, but I'm aware that instead of wastage, some of our pharmacies were experiencing a bonus with the last dose there, more than what was actually allocated in a vial. So Jackie, perhaps you want to come in there. Please don't forget to drop the hand, Clive. Thank you.
Thanks, Gabu, and thanks, Clive. So yes, I think the insurance, especially as you say, it's 688,000 Rand. So if you're insured for R1 million worth of stock, you're adding on almost 700,000. So you will need to review that. When it comes to the indemnity, it's the normal indemnity for giving a vaccination. If a patient has an adverse event, not related to any negligence on your part, in other words, directly relating to the vaccine, you don't need to worry. There is a no faults compensation fund and the government will cover that. So the adverse events, if somebody dies of anaphylactic shock and it was not your fault, it was the vaccine, that is covered. So you don't need to worry about that. Clive, with the wastage, what we've been finding, I think what you would have seen is in the government sector where they're not as worried about cents and rands as we are. Our pharmacies to date have not really had any wastage. And as Gabu indicated, in fact, they've had a bonus on the Pfizer. We are yet to experience the J&J vaccine, so we don't know if there is any extra in there. We have asked for clarity to ensure that there is at least 5 doses there. What our pharmacies to date have been doing is if they open a vaccine vial and it's the end of the day, they always have a list of people they can phone to get them in so that they use up all the doses. So the 27 pharmacies that are running at the moment have had no wastage. Obviously, as the vaccine rollout continues, I doubt it will stay there, but it has been minimal. In the UK, the wastage has been about 2%. All right, then you asked about the credit. So yep. The credit is against your account for the vaccines. So it's not a credit with BioVac or DSV, it will be a credit with the Department of Health. So the idea is you've got 90 days to pay for the vaccines and that these credit notes would be passed before you have to pay for the vaccines. All right, Gabu?
I hope it clarifies, Clive. Otherwise, we can always attend to it, Clive, from the office. There's a question from Vasha, Jackie. She's asking, is there going to be screening template to guide them with the screening before vaccination, or an app that they can use to capture the screening or something like that? Jackie?
So the screening for COVID is just the normal screening that you've been doing at the day. There isn't an app or anything special you need to do. It's just, has the person got a temperature? Do they have a cough? Have they got a sore throat? The screening, the medical history screening, is part of the EVDS. So either you are doing it live through the EVDS, or if the EVDS is down, you are doing it on the form. And all the screening for medical history, allergies, etc., is in that form.
Thank you, Jackie. Yeah, and the emergency tray, Kim is asking, do we need saline solution or Ringer's lactate, or do we need both of them?
So the Department of Health has put that you need an IV bag. So it's a difficult one for me. They are requiring a bag of saline. I think if you get an inspection by the Department of Health, just make sure that you have got a drip bag there. Quite honestly, you're not going to need it. If somebody has any sort of adverse event, you're going to call your ambulance service. But it is a requirement. So I need to say to you, yes, you do need to have it.
Thank you, Jackie. I see the hand of Mr. Mango. Emmanuel, please come through.
Yeah, thank you for recognizing me, Chairperson. Look, my questions is with regards to the MFL system, where in our wholesaler would need to distribute from where it is to the rest of the pharmacies. What I've noticed is that there's a backlog there. It's so slow to get out of the MFL there. I just want to know from Jackie if there's anything that she can do special just to facilitate that process, that one of our wholesalers can get that approval as quick as possible. Because I understand that the opening on the vaccines ordering, it might close anytime, especially in terms of availability, and it's going in rounds. So Jackie, is there any way that you can facilitate that process? Because as of now, with the pharmacies, it's very, very slow. Thank you.
Thank you, Dade Mango. Jackie?
Thanks, Emmanuel, for the question. So please reach out to us. It could be that you have applied for the wholesaler to be a vaccination site, and that obviously will cause a problem. One of the things that you need to do with the wholesaler is that you must only apply to be a distribution. The pharmacies are your vaccination sites. So please reach out to us. We can go into the MFL for you, change that, and we can get it done in 48 hours.
Thank you, Jackie. Please remember to drop the hand, Emmanuel. I think we'll help you through the office to just facilitate that MFL process on your behalf. Thank you very much, Dade Mango. I see the time is clicking away, Jackie. Just
thank you.
From Linda. Thank you, Emmanuel. Just
sure.
Drop us an email, Emmanuel, or call the office tomorrow. We'll be able to handle it.
Sure, thank you.
Sorry, Chair, you're muted.
Oh, okay. Sorry, Jackie. I was having the question here from Linda. Linda says, once the observation time is completed and they have no adverse events after immunization, do you need to check on them in inverted commas or check them out of the system, or can they just leave once the 15 minutes is up? I believe that they just leave after 15 minutes or after 15 minutes of observation.
Correct.
I think that clarifies it, yes. And the vaccination card from Mr. Dyer, yes, it is catered for. You have to give them vaccination card because Mr. Dyer was asking the issue of vaccination cards. It's part of the admin fee. It must be granted. And then I've got a question from Mapula Bridget. She says, will my credit limit with DSV IHD be affected by the COVID-19 vaccine? Meaning it's a separate account, or it will be top up on the same account that she already has. Any attempt there, Jackie?
So we haven't had an issue as of yet from DSV. It could be that most of our orders are going via BioVac. But what I've said to people, if you have an account with DSV, don't worry about ordering another one. When we get your order approved, we will sort out the DSV. So, I mean, if you already have an account, we will facilitate opening a second account if they want it, or increasing the credit limit. So at this stage, apply for the BioVac account. If you've got a DSV, just leave it. If you don't have a DSV, apply for both, remembering that they will only be approved once your order has been approved.
Thank you, Jackie. And then Elaine says, if there is a small dose remaining in the vial, do I waste it or I can give it to somebody under 60? I think you have answered that one to say there is no one under 60. They have to find somebody who's above 60 to give that dose to. Am I correct, Jackie?
Correct.
Thank you. And then Claudia says 2,400 doses multiplied by 80 rands. It gives us 192,000. The difference, I think he missed the slide there that says it is the cost of the vaccine as well as the admin fee of 70 excluding VAT, which comes to 80. Will I be correct, Jackie?
Yes, correct. I think to David, the 192,000 Rand is basically what you're going to be making for doing the vaccinations. Now, right from the beginning, the Department of Health made it clear that this is not going to be a profit-making venture, that this was part of the Ubuntu, and that it was a cost recovery. So you're not going to make a profit. But what I can tell you, the sites that are doing the vaccinations, it is going so well, and the goodwill that is generated is absolutely amazing. But guys, you are going into this to help the country, not to make a profit.
Thank you, Jackie. And Elaine is back, says, an uninsured patient that is willing to pay for vaccine, can it be given? I think the answer is no. The government was very clear that no one must pay for the vaccine, even if they are willing.
Correct.
I would advise Elaine against taking any money before they come back and claim that you were robbing them. So no payment from the public, only the medical aid will pay, and state patients, we await government to give go ahead for them to be able to be covered more than the 5% mentioned. And Gary asked, what about vaccinating foreign nationals over 60 years of age? Policy on foreign nationals, I think they are not covered. Jackie?
No, so if they are legally in this country, they are covered. You would just enter their passport number. Just make sure that the EVDS does accept it. But the policy is that they will cover any legal people that are legally in South Africa. So be careful if they are not legally here, but they are covered.
Thank you, Jackie. That clarifies me too. The outreach sites are commendable, according to Mr. Dyer, says that's good. And how often and how far in advance can we set up the scheduler on EVDS, meaning the bookings? That's Linda again.
Okay, so
can I book in for 5 days in advance, or how far in advance?
all right, so Linda, at the moment, most of our sites are doing it for 5 days, but that's because we are severely constrained in the number of vaccines we've got. When we have plenty of vaccines, the scheduler can actually set up 2 weeks in advance. You are in control. We do not recommend, though, that you go less than 5 days, because an SMS needs to go out to the vaccinee. And if you set up the schedule the day before, they're going to get a vaccination on the day that they're due to be there. So we recommend minimum 5 days, but the best would be 2 weeks in advance.
Thank you, Jackie. We've got 70 new messages in the box, and we've got exactly 1 minute remaining for our webinar. Jackie, what will you advise? Would we rather answer these questions, continue, or will we respond to these questions? Is there any other way we can do it?
All right, so I think we've answered the one on Sisonke. How about pharmacies in a specific area do orders and share the vaccines? We're looking at that, and I will give feedback. There was a question whether we're recording this and will it be available? It will be. The decision not to allow access means denying access to the poor. Absolutely, and that's what we're saying. Is it too early to ask if any small pharmacy currently vaccinating is managing these numbers? No. We have got East Park Pharmacy, who said they could do 50 to 70 vaccinations a day, and they have coped so well with the Pfizer vaccine, we actually cannot supply them quick enough. Claudia, I assume the vaccine admin fee quoted is including VAT. It's 70 Rand excluding VAT, 80 Rand 50 cents including VAT. I have been telling people that are over 60, they've got a 30% greater risk of severe illness, correct? How is the stock allocated to the pharmacy site after you get your order approved? Do we load it on the, yes, you load it on the SVS yourself. Why are the staff at old age homes not being included? They are, if we get approval to vaccinate a retirement village, we do an API upload. So we upload all of the people that are in the old age home plus the staff. But you need to organize that through ICPA. A lot of educators are indicating that they'll be vaccinated soon. Do we have an indication of how? Okay, it won't be us vaccinating the teachers. That is very short-dated Johnson & Johnson vaccine, and that will be done by the government. Jamil says, in the process flow, don't forget to put a step in for EG 60, where you have to claim on your dispensing system for the insured patients before the vaccine is administered. Okay.
Oh, just an advice, that one. Yeah. If
How
they claim and see if it passes, then you can then vaccinate. It's an administrative advice.
Yeah. How quickly will the DOH approve vaccines done through the correct EVDS to credit our accounts? We've been told 7 to 14 days.
Thank you, Jackie.
After the 15-minute observation period, the vaccinees have to be signed out of the facility on the EVDS. That was your experience. Ahmed, that was under Sisonke. So that was a clinical trial. On the normal vaccinations, you do not have to sign them out.
Okay, we will share the recording obviously on our groups, maybe through the info flash. So for those that are load shedding at 8, how do we get that? We will do that.
All right. Somebody's asked for some frequently asked questions. We can do that. There was also a question about when will it be available to under 60s. So I think when we have more vaccines available, at the moment they are saying that when 70% of the over 60s have been vaccinated, they will open up phase 2B, which is the 40s to 59s. I think it'll be sometime in July when there are more vaccines. At the moment, there just are not even enough vaccines for the over 60s. So, but it shouldn't be long, guys. We are going to be seeing millions of vaccines coming into the country from July onwards.
Yeah, and I think it's important, Jackie, to mention that James indeed approached ICPA to say, please, can you allocate us pharmacies that will be able to vaccinate our staffers in the government offices, the police stations, and the likes. Absolutely. So we are working on that as a program in action. Ahmed will be communicating that very, very soon to say how that will work. And any other comment, Jackie, from your side and advice for our members?
No, I think, please, guys, if you've got any questions, ask the office. We are here to really facilitate you through this process. You do not need to deal directly with the Department of Health. We can do everything for you. Just ask the office. My ladies and my gents in the office are really up to date and will help you. Email or phone.
Thank you very much, Jackie. I think that sums it all for tonight.
There's just one hand, Khabu, iPhone.
Okay. iPhone hand, please come through.
Hi, how are y'all? I just want to find out, when are we expecting to receive the vaccines?
So the orders, if you have put your orders through to me, I put through, I think, 28 orders yesterday. We are now collecting the next orders. I will be submitting them so that when the Johnson & Johnson vaccine is released, those orders will go out in the first shipment. So get your orders through to us. We are waiting on the FDA. It was supposed to be Friday, then it was supposed to be today. Now they're talking about this Friday. So it all depends, unfortunately, on the FDA and the release of the Johnson & Johnson vaccines.
But it could be any time from now.
Yes.
Thank you very much, Jackie. And the healthcare workers that are remaining behind, there's a link on the groups that is saying vaccine for healthcare workers. They must go through that link and book again. It will allocate them immediately for vaccination. I see iPhone. Is it the legacy hand or is a new hand iPhone?
I think it's the old hand.
Thank you. If it's a legacy hand, thank you. Just drop it there. Thank you so much.
Thanks, Kapu.
From my side, Jackie, I think I'm covered. I will just be looking out for questions on the groups so that we can assist those that couldn't make it into this webinar. So let's quickly make this webinar available for everybody to listen to it at their own times, especially those that couldn't come through because of the limit of participants. So colleagues, thank you very much for your time that you have taken tonight. I hope that it was informative and it was beneficial for you, and it clarifies any worries or doubts about this rollout. We believe that anytime Johnson & Johnson will come through, and once that is coming through, we've got 500 pharmacies that are also awaiting to just come for that J&J vaccine to come through by mid-July. We should have those 500 pharmacies loaded on. So people are really coming through thick and fast. So let's encourage our colleagues, those that have not registered to be vaccinators, to also do so while we're still waiting for the vaccines, so that when the vaccines come, we hit the ground running. So with this, I just want to say thank you very much. And I hope that you have benefited from this session. If needs be, we will arrange another session soon through the office. So thank you very much. Good night and keep safe. Your last word, Jackie? Thank you.
Good night, everybody. And really, from the office, we salute all of you guys on the cold face. You're doing such an amazing job. We are so proud of all of you. Keep safe and
Thank you
call
so
us
much.
if you need some help. Bye-bye, everyone.